Hi, I'm Dr. Brian Burnikel. I'm the medical director of the Joint Replacement Center at Greenville Hospital Systems and co-director of the Total Joint Institute with Steadman Hawkins Clinic of the Carolinas. Today I'd like to give you some background information regarding total hip arthroplasty. Total hip arthroplasty originated in the 1940s and over the years has progressed to a very successful procedure now in the United States. We do over 400,000 total hip replacements in the U.S. each year.
The aim of the operation is to replace the worn-out and painful head of the femur, or ball, and the acetabulum, or socket, with a man-made device. With the standard total hip replacement, the femoral component goes into the femoral canal and has a ball attached to the top. The acetabular component goes into the socket of the pelvis, and a liner is then inserted into this. These devices are combinations of metal, plastic, or ceramic. They are fixed to the bone either using bone cement or by using a prosthesis with a rough surface, which relies on your own bone to grow into the implant for long-term stability.
Why is it that a hip joint becomes painful? Usually the pain occurs when one side of the hip joint has been injured or damaged.
Over time, the cartilage, or smooth covering on the ends of the bone, starts to crack and wear away. When this happens, the bones making up the joint rub together, and this is what causes the pain. No matter what age you are, a hip problem may keep you from activities that you really enjoy, and can even cause pain at rest and prevent patients from sleeping. As time goes by, normal wear and tear can add up. The cartilage may begin to wear away, similar to the tread on your tires. As cartilage wears, the joint space narrows and the bones start to rub together. The bones become rough, spurs or osteophytes may form, as well as degenerative cysts on both sides of the joint. There also is a group of conditions where the lining of the joint becomes inflamed and secretes a material that destroys the joint cartilage. One example of this is rheumatoid arthritis. In these conditions, more than one joint is usually affected. The joints can be hot, swollen, and painful, and many times deformities can occur. Another process that can cause hip pain is avascular necrosis. This is a process where the ball portion of the hip joint loses its blood supply and may cause it to deteriorate. This can occur at any age, and certain conditions such as excessive alcohol use, the use of steroids, or a traumatic injury, such as a fracture to the hip, can cause this condition to occur. Once the bone dies, it becomes rough and arthritic. Unfortunately, this can happen to young adults. How is the diagnosis of hip arthritis made? The diagnosis of hip arthritis is made based on your history, your physical examination, and probably most importantly, x-rays of your hip joint. There are no blood tests to diagnose osteoarthritis or wear and tear arthritis of the hip, unlike rheumatoid arthritis or inflammatory arthritis. When should you consider surgery on your arthritic hip? Well, x-rays will first determine the severity of the arthritis in your hip joint. If your arthritis is severe, your surgery is determined by your level of pain and the impact that the pain is having on your lifestyle. What are the benefits of surgery? You do not have to live with a painful hip the rest of your life. After a total hip replacement, you can look forward to moving more easily and without pain.
In preparation for your hip surgery, your orthopedic surgeon will usually have you undergo a good general physical examination by your internal medicine physician. This is to make sure that all of your underlying medical conditions are under control and you're in the best condition possible to undergo this procedure safely.
The medical evaluation may include a physical, blood tests, an EKG, which is also called a heart tracing, urine tests, and potentially a nose culture to make sure that your body is not carrying any strong resistant organisms that could increase your risk of infection. In addition, our Total Joint Center offers an education class given by the nurses and physical therapists to give you detailed information and answer any questions that you may have about your upcoming surgery. An education booklet with illustrations is also provided. Finally, you will need to visit the hospital admissions department prior to surgery to register and meet with the anesthesiologist. Other important things to do before surgery include stopping aspirin and anti-inflammatory medications 10 days prior to the surgery, as they may increase your risk of bleeding. Stop any naturopathic or herbal medications 10 days prior to surgery, again, because they may increase your risk of bleeding. Continue with all other medications unless otherwise specified. Please notify your surgeon if you develop any abrasions, pimples, redness, or swelling around your hip joint. It is also advisable to stop smoking for as long as possible prior to your surgery. Now let me give you some information about the procedure. The anesthesiologist will see you before surgery. They will discuss with you the options for anesthesia. Normally, a spinal anesthetic is chosen. With a spinal anesthetic, you are numbed up from the waist down. This is the safest type of anesthesia for hip replacement surgery. You will be given several medications to reduce your pain after surgery. Then you will be taken to the operating theater. After your anesthesia, a urinary catheter will be placed in your bladder to measure your fluid balance during and after surgery. A cut is made in the skin and underlying tissue to expose the hip. We use minimally invasive techniques whenever possible. The hip joint is dislocated and the femoral head or ball is removed. Special instruments are used to make very accurate cuts in the bone to fit in the prosthesis. Trial implants or components are put in first to make sure that everything fits properly. The bone is then cleaned to remove all debris. The real and final hip components are then inserted. The wound is then carefully closed in layers, the last layer being the skin. A compressive dressing is applied, and you are taken to recovery. What can I expect postoperatively? You will have a sterile dressing on your hip. You also have an ice pad applied to it. Your fluid input and output is measured carefully. You will have a drip in your arm, which will be used to give you fluid as well as pain medicine and antibiotics to decrease your risk of infection. Pain is normal after the operation, but if your pain is not relieved by the medications, it's very important that you notify your nurse. Pain medication may be given by mouth or may be delivered intravenously into your bloodstream. The catheter is usually removed from your bladder at approximately 24 hours after surgery. Blood will be taken 24 and 48 hours after the operation to check your hemoglobin level as well as your blood chemicals. Your exercise regimen will begin the day of surgery and will continue during your stay in the hospital as well as at home. A physical therapist will supervise this during your stay at the hospital as well as at home. You will generally be discharged 1 to 3 days after the surgery. In most cases, you will be able to go directly home from the hospital. Some patients, however, are discharged to a rehabilitation center for some continued therapy to gain further independence prior to going home. A physical therapist will assist you at home for several weeks. You may also have 1 to 2 visits by a home health nurse to check your incision and to make sure that you are doing fine. The sutures are usually the dissolving type, but occasionally stitches or staples will need to be removed from the skin. This will be done either by your physician or by a visiting nurse. How about activities? You should avoid pounding activities after a hip replacement because this can increase the stress on your hip joint. You may progress your activities as tolerated, however. Walking is good. Swimming is a good idea after your incision has healed. It's okay to get in the ocean in light surf. Doubles tennis is generally recommended over singles tennis, and you should avoid contact sports. Skiing on groomed trails is okay. If you're a good skier, please talk to your physician about more aggressive skiing. Other activities, please consult your physician if you have any questions or concerns.
A natural question of many patients is, how long is this new hip going to last? Well, if we look at the results of hip replacements that were done 20 years ago, 85 to 90% of those hip replacements have not had to be redone. Most patients get excellent improvement in their pain and also are able to return to activities they were not able to do prior to their hip surgery. One thing that I ask my patients to remember is that the more that they do, the more stress they'll be putting on their new hip joint. This is similar to the tires on your car. The more miles you drive, the more likely your tires are going to wear out. Some of the materials we're using in hip replacements now have cut down the wear and tear in the hip joint significantly. We think that our current implants are going to last much longer than those that were used 20 years ago. If you have any further questions about hip replacement, please ask your surgeon. I appreciate you taking the time to watch this information video.